Hi, everyone, and welcome back to another episode of From Print to Pod. This time around, we have Dr. Adame with us. I'm very excited because she wrote the article Lady Docs Protect Your Health, both physical and mental. And we are going to be asking her all kinds of questions within the span of a short episode. So, Dr. Adame, welcome and tell us a little bit about yourself.
Okay. Hi, Donna. Very excited to be here. I'm Dr. Noemi Adame. I'm also known as the Veggies Over Pills doctor. I'm a board certified pediatrician, a whole food, plant based home cook and baker. I'm a writer. I'm a speaker with over 20 years of experience in medicine. I'm the founder of Culver Pediatric Center. It's a concierge style direct primary care practice where we take a holistic approach to the care of the child. And our clinic was honored to be one of the best physician offices in Marshall County 2024. We just found out 2025 also. Beyond the exam room, I'm passionate about advancing the direct primary care movement, as most DPC docs are, of course, but in a way that's sustainable and burnout proof, especially for my female physician colleagues.
Okay, amazing. And you brought up something I just have to interject how timely, because we have a food conference coming up online that's Healthcare's
Yeah.
Kitchen. And so that is wonderful. And I hope that you join us. All right, so let's get straight to the questions. The questions, of course, are based on your article. So if you're watching this episode and you have not read the article yet, head on over to our magazine and find it and read it. So, number one question is what inspired you to write it? I think you answered some of that before, but was there also a specific moment or experience that prompted this piece?
You know, this article has been percolating in my heart and in my mind for years. I remember as a young hospitalist noticing different interactions that patients and staff had with female physicians compared to male. I remember working in clinic when I was employed in corporate medicine and watching as my male colleagues left at 5:30 while I was still there, sometimes hours later, still documenting and charting. And of course, imposter syndrome takes over. And I thought it was me. I thought I was the problem. I thought I was not as good. I thought I was less efficient. I even asked my employer for a time flow study. And the person who watched me and conducted the study was an EHR super user. And she found I was very efficient with my time. She found that I would come in early to prep. So by the time I walked into the exam room, the visit was very streamlined. I was not looking through the chart. I was not trying to gather all this information. I was already very prepared. She even commented on my typing that it was very fast, that my notes were very thorough, that a scribe would actually be a downgrade and not helpful. So fast forward to me leaving corporate medicine to start my own DPC practice, I realized very quickly that there's issues and concerns that affect female physicians, female DPC docs disproportionately. And it makes sense, right? As I mentioned in the article, portal data shows that both patients and staff make 25% more requests of female primary care docs than male, which explains the longer work days and the longer EHR time that is uncompensated and unrewarded time. So with this data and other issues like that second shift at home, it's not surprising, right, that studies show that female doctors have higher burnout rates. And then, and really to answer your question, the sentinel event for me, and I call it that, it was when my mother died suddenly and unexpectedly in 2023. I owned my own practice. I was the boss, but I did not feel I could disconnect from work, and I showed myself no compassion in that situation. I look back and I realized there is so much I could have done to fully disconnect and be present in the moment. But I think it was a trauma response and also me responding to years of socialization of women must put the needs of others first. And I really think that socialization is is magnified for female physicians. So I literally sat in the ICU watching her die while I was responding to texts and sending refills to the pharmacy. And in the aftermath of processing that trauma, I reevaluated my entire life. I restructured a lot of my processes. I hired help. I outsourced social media to my daughter, so she's our nepo baby. And it took me a long time after that experience. You know, here we are in 2025, right? Not only to articulate those thoughts and feelings into words and to embed a lighthearted twist, right, on a very, very heavy topic, but to have some sort of solution and action plan to go along. I wanted to put the thoughts into paper, but I didn't want to just bum everybody out with this concerning data. I wanted to actually offer a solution to the problem. I am the firstborn daughter of immigrants. Problem solving laced with external validation is my drug of choice. So I needed to also present a solution. And the push that I needed really came in two ways. The first, an article published in JAMA less than 2 months ago that essentially showed that while women generally outlive men, that's not the case amongst physicians. We do not have that longevity benefit, and there's a lot of reasons explored in the article. But the added stress of specifically being a female doctor likely contributes to that. And the other push that I needed was when I attended the pediatric DPC mastermind around the time that the study was published. And I mentioned that I did retreats for some of my parents as a pediatrician. And Dr. Deanna Berry, who coordinates the mastermind, sidebarred me and said, "You need to do retreats for us." And so basically that's all I needed. I said, okay, I have the information to put pen to paper, but also a solution. And that's in the form of a physician women's retreat, which is scheduled for September 4th through 7th of this year.
Amazing. Thank you for that. And I'm so sorry about your mom.
Thank you.
So how does your background in lifestyle and culinary medicine influence your approach to physician wellness?
So I believe, as a pediatrician, I believe healthy kids start with healthy adults in their lives. And as doctors, if we're truly honest with ourselves, we're not saving lives from the exam room. We're not saving lives from the operating room. I mean, we are in a way, but the real way to save lives is from the kitchen. Food is medicine. And I really feel that as a physician, if we are not implementing lifestyle measures, and by that I mean nourishment, restorative sleep, mindfulness-based stress reduction, social connection, avoiding risky toxins, all those principles of lifestyle, physical activity, if we're not implementing and incorporating and embedding those principles into our daily practice and the way we advise patients, we're being irresponsible as physicians. So it's a little tricky in pediatrics, right? Because you cannot tell a 5-year-old or a 10-year-old or a 15-year-old, oh, you need to eat more veggies. Oh, you need to put, it really does involve the family. And the way we've done that is a couple of ways. First of all, I've done training for myself, but my nurse also. So she does both group coaching with the kids and the parents through these little like almost camp style like events. And she also does one-on-one, including cooking classes, both in our kitchen and in the family's kitchen. She hosts something called Camp Veggie, which we've partnered with one of the local colleges. They have a greenhouse, and she teaches kids about the powerful connection between the earth, food, and our health. And this is the second year in a row that we're doing that. So really, the lifestyle medicine is embedded in the way I practice. So for example, if I see someone with an ear infection, yes, I'll prescribe the antibiotic, or I'll recommend the antibiotic. I'll recommend, intranasal saline rinses for the congestion. I'll recommend some supplements, but then I'll also recommend, okay, let's eat more of these foods to reduce inflammation and to strengthen the immune system. Let's go out and touch the earth and connect, and that restabilizes our microbiome. So I don't differentiate between, this is better than the other. This is all part of the management of any condition I treat, whether something as simple as an ear infection or something as complex as depression, anxiety, ADHD, PANS, PANDAS. I incorporate those principles into the way I manage any problem.
Beautiful, especially as someone who loves the kitchen and loves to cook, especially healthy food for my family. Kudos on that. All right. In your article, you discuss the mental health challenges faced by female doctors. What strategies have you found effective in addressing these challenges?
So one of the challenges that I face as a female doctor is very debilitating people pleasing, and not prioritizing my own wellness, my own mental and physical health. And one of the things that has helped me is an acronym. Since we were in medical school, right? We loved acronyms. And the acronym is FAST. When I feel like someone is pushing a boundary. And I've always accepted that I don't set rules for patients. Like I don't set rules like, oh, don't text me after hours for something like a refill, or I don't scold families. I don't make rules like that. But I set boundaries. You might text me for an ADHD refill on a Friday night, but my auto reply strictly, very clearly states refills will be fulfilled in 48 hours. So even though a patient might text me on a Friday night for an ADHD refill, I won't reply until the time frame set within my own boundary. But an acronym that has really helped me when I feel like someone is trying to push that boundary, especially with that innate people pleasing and just wanting to prioritize the well-being of others over mine, is that FAST acronym. And so the F stands for fair. Is this fair? Is this fair to both of us? Is it fair for me to fulfill a refill for ADHD meds on a Friday night when all the pharmacies are closed? When this is not an urgent thing. That just asking myself that has really, really helped. And it might even be that the patient isn't even wanting me to refill the medication at that time, but it's that mindset change, that especially having been a hospitalist, right, where it just seems everything is an emergency, that asking myself, is this fair, has really, really helped. The A stands for stop apologizing or apologizing. No apologizing. I've really gotten out of that habit of saying I'm sorry and apologizing a lot of times for things that are not even that are out of my control. For example, if now in direct primary care, fortunately, my appointments run on time. But the expectation for my families is really that if their appointment's at 2, they're going to start their appointment at 2. There are a few times every once in a while where I might be running like 3 or 4 or maybe 5 minutes late. And because my families are used to their appointments starting online or on time, I do start getting texts of, hey, so are we meeting? I haven't gotten the link and that kind of thing. And so one thing that has helped with that anxiety that I get when I start getting those texts is instead of apologizing once I am able to get to the appointment, I don't apologize. Instead, I say, thank you for waiting, or I really appreciate your patience. Because if I am running a few minutes late, it's not intentional. It's not because I was, sitting and just letting time go by. There's a reason. So I don't apologize for things that are beyond my control. Instead, I show appreciation for their patience. The S stands for stick to your values. So if someone is pushing that boundary, I really do stick to that boundary, because the moment that you don't, then that person is going to think that boundary is imaginary or doesn't really exist or doesn't apply to them. So it's very important to stick to your values and your boundaries. And then the T stands for tell the truth. Don't exaggerate. I do tell families, if I were to do this, if I were to do this for every patient, what you're requesting, I would need to increase my fees for everyone. And so when I say things like that, and I'm honest and truthful about those types of situations, families get it and understand a little bit better. Like, oh, okay, what I'm asking for has consequences. So that acronym has really helped with reframing my mindset around what is truly an urgent issue, what is truly fair, and enforcing the boundaries that I have set. And that is so important for my physical health and my mental health. And most patients understand because they want me to do this for a long time, right? They know that a healthy me means that I can take care of their children for a long time.
Thank you for that. The next question revolves around medical institutions. What advice would you give to them for better support, for better supporting the physical and mental health of their female staff?
And I'm going to be very cynical here, because before I left both of my previous jobs, before I left to open up my own direct primary care practice, I was very clear on what I needed. I needed more time. I needed more administrative time. I needed more indirect patient care time to prepare, to document, to answer portal messages, to huddle with my team, and I gave them very clear, very clear outline. Schedule my patients this way, schedule my calendar this way. I was very specific, and I was told no. We can't do that. For example, I with one of the jobs I asked, I want to work 4 days a week. I just 1 day off, even if I work 4 10-hour days. I was willing to do that. In addition to the hospital call that was completely out of that, contact time. And I was told no, because, then we would need to pay the staff overtime, and then we would, we would need to keep the lights on longer, and all the excuses. I asked for, for more time. No, because then that means you're going to see less patients, and that's going to decrease RVUs. And so I was very specific with what I wanted from two separate corporate entities, and was told no. But ultimately, that is what we need, is time. We need time with our patients, but also time to prepare, time to answer all these messages, time to document thoroughly and effectively afterwards. All that takes time. And other than the direct patient care time, we're expected as physicians to do that on our own time. Like it's like this, fun thing that we just do for fun, right? Answering portal messages and documenting and chart prepping, because those activities, even though they're important for patient care, for good patient care, they do not generate revenue. And so I have a very hard time believing that the corporate medicine world is going to give female physicians these tools that they need, this additional time that doesn't just come up from the air. I hope I'm wrong. I do believe that that the tides are turning, because a lot of things that are happening, that specifically with physicians speaking out about the current system and how broken the current system is. I do think that the tides are turning. I hope to see it within my lifetime. But ultimately, the things that we need to provide better care for our patients, so that we can continue to provide amazing, top-notch quality care, is time.
Thank you for that. The next question is, are there any misconceptions about physician wellness that you'd like to address?
Misconceptions. Yes, I think one of the biggest misconceptions is that burnout happens because to doctors that are weak, that are not resilient, that it's an individual problem. And it's not. It's a systemic problem. When I made the realization that I was not surviving in the corporate medicine world, I was not surviving at all. And it was very interesting, because I worked in an outpatient clinic. I had worked as a hospitalist, doing very complex care and teaching, and it was hard work. I had resident hours as a hospitalist. I was getting there early in the morning, leaving there late at night, taking call, coming in. But it felt different. And I think when I do the autopsy, right, I think the difference when I was a hospitalist is that I had all day. I could round on a patient all day long. I could go back and see them 3 times. I could sit down, review their chart, sit down with my residents and my medical students, and really think through the problem and analyze and really do an in-depth deep dive into the patient's case. And I had the time to do that. In the corporate medicine world, I did not have that time. I did not have that luxury. It was, okay, you've got 10 minutes. And it doesn't matter if it's a kid with a sore throat or a first-time mom with a newborn who's having trouble breastfeeding and she's in the room crying because she can't get the baby to latch. You've got this much time. So it wasn't the complexity that was the problem. I was used to taking care of very, very complex patients. It was, once again, it was the time. And so I don't think that this burnout or it's not burnout, it's moral injury. It wasn't happening because I wasn't strong enough, or I was weak, or I wasn't resilient enough. I think I was just so demoralized. I was just so demoralized. I was so morally injured by the expectations of corporate medicine. And I got to where I didn't just hate the doctor that I had become. I hated the person. I hated the person that I had become. And it was such a devastating realization and frightening realization to make. And I think it was scary for my family also to make that realization. So the issue isn't individual doctors when it comes to physicians' mental health and burnout. It's systemic. It's a systemic issue, and the way that and at least for me, I knew that the only way that I could have survived, and I could have, was I had to stop caring, and I was not ready to do that ever. I had to stop caring that I had a mother who was crying because she could not get her baby to latch, and I wasn't going to have the time to help her. And all I could do was, okay, I'll refer you to a lactation consultant, and good luck getting in. I knew that I could not live with that. So it really was either leaving the system or leaving medicine. And thank goodness I found out about direct primary care around that time, because otherwise I don't know what would have happened, but otherwise really, because the option if I was going to stay in that system, it was to stop caring.
Yeah, that really resonates with my own past. Thank you for that. So, for listeners who are female physicians, what is one actionable step that you can take today to begin prioritizing their health?
One very practical tool is to leverage tech and automation so that you can offload those tasks that can be automated and then focus on the things that cannot. And that will expand your bandwidth to provide that high touch, personalized care that can only come from a warm, nurturing body in the room. So there's certainly a lot of tools out there, but I think that using the most of tech can have a very meaningful impact on our workflow, and when you are not decision fatigued by making these little decisions that can be automated, it really frees up not just the time, but the emotional bandwidth for personalized care.
Yeah, I couldn't agree with you more on that, for sure. Okay, so thank you for all of those answers. For those of you listening, if you really resonated, if everything that Dr. Adame said has resonated with you, you can go ahead and read the article once again. Lady Docs Protect Your Health, and her digital business card is right below the article, and you can click in it, read more about Dr. Adame, and even send her an inquiry. So, Dr. Adame, thank you so much for taking your time to spend this episode with us.
Thank you for having me.